Order of business, Senate Bill 5822. Senator Randall, there are substitutes in order.
Thank you, Mr. President. Bear with me.
Senator Elias, the substitute is in order.
Thank you, Mr. President. I move that second substitute Senate Bill 5822 be substituted for Senate Bill 5822 and that second substitute 5822 take its place on today's second reading.
Senator Elias, move that second substitute Senate Bill 5822 be substituted for Senate Bill 5822 and the second substitute Senate Bill 5822 take its place on today's second reading calendar. Hearing no objection, so ordered. Second substitute Senate Bill 5822. The Secretary will read.
An act relating to providing a pathway to establish a universal for this section expires January 1st, 2021.
Amendment at the desk. Secretary will read.
Amendment 392 by Senator Oban on page 2, line 37. After that,
Last line.
insert an employer-provided insurance plan and.
Senator Oban to move adoption.
Thank you, Mr. President. I move adoption.
Senator Oban's moved that the amendment be adopted. Remarks, Senator Oban.
Thank you, Mr. President. The underlying bill, as I understand it, is an effort to establish a work group to take a look at universal health care or a single-payer option. I think that will send some real concerns among members of the public who rely on their employer-provided health insurance plan. All the polling I've seen indicates that the vast majority of Americans, and certainly Washingtonians, prefer that coverage. And if we're going to embark on a work group that will look into possibly a single-payer system and turn insurance financing as we have it upside down, we want to reinsure folks that their individual plans they get through their employers, which is 80-some% of our state get their insurance through that method, will not lose it. So this amendment would ensure that this group will make sure that it preserves the private employer insurance market and protect an individual's right to keep an employer-provided insurance plan. I urge the body to pass this. I think without it, this work group could send shockwaves for those who hear about it. So I urge the body to adopt it. Thank you.
Further remarks on the amendment, Senator Randall.
Thank you, Mr. President. I appreciate the good senator's investment in ensuring that Washingtonians have the health care coverage that they can depend on. But I believe this amendment is more prescriptive than we are hoping the work group will be. We did not, in fact, dictate that the work group bring recommendations on a single payer system. We are asking the work group to bring recommendations on a system of universal health care. That may include single payer, it may include private insurers, but dictating ahead of time what the work group's findings should be makes me feel like maybe we shouldn't have the work group at all. So, and I'm invested in ensuring that we're bringing people together to have a conversation about what the right choice is for Washington. So I respectfully urge a no vote on this amendment.
Further remarks on the amendment, Senator Short.
Thank you, Mr. President. I'm actually rising in support of this. I think the biggest challenge that we've had as we are looking to transform our healthcare system is making sure that we do so in a way that does not impact what people have. And so while the work group is probably a good idea, I think an even better idea would be to keep this in there. So as the group focuses on what they want to do, Mr. President, that they do it in a way that doesn't impede the coverage that people already have today. I think it's a great amendment, very thoughtful. I urge support and I ask for a roll call vote.
A roll call has been requested. If sustained by 1/6 of the members, there will be a roll call vote. Further remarks on the amendment, Senator Cleveland.
Thank you, Mr. President. Well, I am also going to oppose this amendment. I believe that this work group needs to examine and explore from the broadest perspective possible all options. And single payer doesn't necessarily mean that the healthcare market ceases to exist. All we need to do is look to Medicare for proof of that. There's a very robust Medicare Advantage health insurance market that exists. And so I'll be asking for a no vote on this amendment.
The question before the Senate is the adoption of the amendment proposed by Senator Oban. A roll call has been requested. The demand has been sustained. Therefore, there will be a roll call, and the Secretary will call the roll.
Bailey. Becker. Billig. Braun. Brown. Carlisle. Cleveland. Conway. Darnielle. Doss. Dingra. Dingra. Erickson. Fortunato. Frocht. Hasagawa. Hawkins. Hobbs. Holy. Honeyford. Hunt. Kaiser. King. Kuderer. Leas. Lovelet. McCoy. Mullet. Wynn. Oban. Padden. Palumbo. Peterson. Randall. Rivers. Rivers. Rolfus. Saldana. Solomon. Schessler. Sheldon. Short. Taco. Vandeweghe. Wagoner. Walsh. Warnick. Wellman. Wilson Claire. Wilson Linda. Zeiger.
Senator Rivers. Senator Palumbo, how do you vote? Senator Honeyford, how do you vote?
Mr. President, there are 21 yea, 28 nay.
The amendment is not adopted. Further amendment, Secretary will read.
Amendment 407 by Senator Oban on page 3, line 28,
Last line.
after internal references accordingly.
Senator Oban to move adoption.
Thank you, Mr. President. I move adoption of 407.
Senator Oban's moved that the amendment be adopted. Remarks. Senator Oban.
Well, as long as this work group will be looking at single-payer systems for this state, I think it ought to look to our neighbors to the north, which have had a single-payer government-provided health care for some time. I'm not an expert on that system, but I do hear many times that our neighbors from the north come across the border to get health care from the more free market system of our country, and certainly in Washington State. So I'm hoping that the work group will study how many individuals seek health care from a socialized one-party system such as Canada to come to Washington or other border states for health care, and vice versa. How many Americans go across the border to seek health care from the Canadian system? My guess is we'll find there's a disproportionate number who travel north or south but don't travel north. And I think it would be further informative for that body, that work group, to look at the type of care that's being sought. What's the care they're not receiving? on a timely basis or at all on a quality basis in Canada that they come to the U.S. for. I think that would be very instructive, very helpful for this work group, and I urge the body to accept this amendment. And by the way, it's not prescriptive.
Further remarks on the amendment, Senator Randall.
Thank you, Mr. President. I am urging a no vote on this amendment, perhaps unsurprisingly, not because I don't think it's valuable to examine the health systems in neighboring countries, but because this is outside of the goals of this work group. I imagine that the work group will consider what some of our neighbors are doing, but is tasked specifically with coming up with a policy that is of the most help to the people of Washington State, not to our Canadian neighbors. Also, in Healthcare Committee, we've heard over and over from some of our colleagues across the aisle about the undue burdens that we are putting on providers and practices, asking them to collect more data, asking them to comply with increased regulations. There is no current policy that requires providers to ask their patients, why have you turned down healthcare somewhere else? Why are you seeking healthcare with me? And asking them to collect information on each individual's reasons for declining healthcare services in their native country, I believe would place an undue burden both on the work group and the providers we would be asking to comply. So I urge a no vote.
Further remarks on the amendment, Senator Schessler.
Well, thank you, Mr. President. Really, this seems quite reasonable. I visited a hospital in Southeast Washington, and the orthopedic surgeon there had brought her mother down from Canada. Because she wasn't willing to see her mother suffer, she paid for hip replacement herself because her mother didn't need to suffer that long. How common is this? We're told oftentimes if you go to the excellent medical facilities in Spokane, the cardiologists always have Canadian patients in the waiting room. Is this still it? Why not check it out? Question is, why not? If I look in my district, Mr. President, across the line, an imaginary line to Idaho, I asked in Ways and Means, 3 people on a panel, how many plans are available in Idaho? They still won't answer my question. They have a different system. We can't look at how many plans are available in Moscow or Lewiston. Mr. President, unless we have a predetermined outcome of socialism, why not look to the north and the east across the border and just look and see, count. It's not that hard. I urge your support.
Further remarks on the amendment, Senator Frocht.
Thank you, Mr. President. Well, I just want to remind the body, this is, of course, a study. That is what this bill does. But I think all the Canadians I've met over the years, and many of them, and the single thing, and I was just in Australia, who has a somewhat similar system, nobody I have ever met says they would trade their health system for ours. Now, what our ultimate health system looks like remains to be seen. But I think we should just keep that in mind. So I'm sure that this work group will look at a bunch of different systems, including Canada, and the pros and cons, and there's no perfect system, including ours, including theirs. But I just want to note that if you don't have to take my word for it on how Canadians feel about this. In 2004, there was a survey they did, and it was called Who is the Greatest Canadian of All Time? And under the survey, the Canadians selected Tommy Douglas, the father of Canadian healthcare, their so-called Medicare system, as the greatest Canadian of all time. And I would just say, I don't think they would have done that if they didn't like their healthcare system. So when we are done with this bill today and we adjourn, I will nominate Emily Randall as the greatest Washingtonian of all time.
Further remarks on the amendment, Senator Erickson.
Well, thank you, Mr. President. Rising in strong support of this, and I don't understand if people think Canada is such a great healthcare system. I love my great friends in the North. They shop at my Costco all the time. Why we would be against this amendment? And so let's just line it up head to head and require it. And if you think that the Canadian system is so wonderful, then hands down, this should be selected. So just for the record, I represent Northwest Washington. I have 5 international border crossings with Canada. In Bellingham, we are blessed with one of the finest heart surgery centers in the entire world. And so you might say, why on earth would we have one of the best heart surgery centers in the world at Peace Health in Bellingham, St. Joe's Peace Health, in a little town of Bellingham? And it's been there for many years, even before Bellingham started to grow. Well, what we have is we have close proximity to about 3 million people in the lower mainland of British Columbia. And they come to Bellingham to get their surgeries. And that's why they come. And that is why we have one of the most phenomenal heart surgery centers in the entire world, is because Canadians want to come down and get it. There's a joke about healthcare in Canada. 98% of Canadians are happy with it. The other 2% had to see a doctor. And so if you want to wait in line, Canada's a great place to get healthcare. But if you want to get other types of access to health care, you're going to come down. And I appreciate the good gentleman saying he's never met a Canadian who doesn't like their health care. That reminds me of my trip to Washington State University last year to speak at a conference on climate change, and they told me nobody there was going to vote for President Trump. And so it all depends on who you talk to in these certain situations with regards to how they like their health care. But I think it's important that we do compare between the United States and Canada with regards to access. And at the heart of this whole debate tonight is access for the highest percentage of people possible. And in America, if you have access to health care insurance, you have access to the best health care in the world. And what we should be doing is taking that small percentage of Washingtonians who don't currently have the insurance and make them eligible and make health care more affordable so they can get it, instead of trying to turn our entire health care system on its head for the 12%. If you have 85% or 90% of Washingtonians who have access to great health care, why am I going to flip the system for the 10% that don't, rather than try to put in place a program that will help that 10% get the access that they would like? And again, just to stress one more time, I think Canada's a great example. Health care insurance and health care access are 2 different things. And it really comes down to how long do you want to wait? And you compare yourself to Norway, to Canada, to whatever you want, places that have socialized medicine. Norwegians come to America for healthcare services. And one last story, I was actually on an airplane flying to Thailand a couple of years ago, and on the flight sitting next to me was a young East Indian gentleman who was flying to India from Canada to get healthcare because the wait in Canada was too long. He had to go back to East India to get his surgery. So I think it'd be a great comparison. Let's set it up, apples to apples, and compare. And if you think it's better, you should vote yes. If you want to say the Canadian system is great, don't be afraid of this amendment.
Further remarks, Senator Elias.
Thank you, Mr. President. I believe in government efficiency. So while we were having this debate, I entered into my Bing how many Canadians come to the United States for health care, and I think we can unanimously reject this amendment because I found the answer. Fraser Institute at FraserInstitute.org did a study and found that in 2015, 52,000 Canadians received non-emergency medical treatment outside Canada. So it turns out Senator Erickson is right. 98% of people get their care in Canada, and 2% seek their care outside of Canada. So I'm glad that we've answered the question that's in the amendment. I think we can all agree that we don't need to add this to the work group's agenda. They can just download the same report that I found in about 3 minutes online, and that will help inform their discussions, asking for a no vote on the amendment.
Further remarks on the amendment, Senator Becker.
Thank you, Mr. President. Well, I'm going to stand up in strong support of this amendment. I was in the healthcare field for 24 years, Mr. President, and when we started our ambulatory surgery center, we went to, my charge nurse and I went to a conference. I don't remember where it was, it doesn't matter, but the point that I would like to make is sitting there talking with people at the lunch table, and we ended up, there were about 14 of us around the table, and there were 2 nurses from England that were telling us that our turnaround times were so slow, et cetera, and that's meaning from one patient to another when you do your clean and have your next patient ready for a major case that you would do in a surgery center. Mr. President, the topic came up, and I asked finally, because of what they were talking about, how many people they actually saw in their surgery center in a day, and it was about half of what we saw for the same type of procedures. And I say, so what did you do, ladies, when you had a patient, or you have a patient that has a bad headache and it's a sudden onset and it's starting in the back of their head and they're in tears and they've never had a headache. And they say, well, of course, they go to their doctor. And I said, how long does it take them to get their MRI or their scan? And they said, well, it can take up to a year. And I said, what if that's an aneurysm and they don't have that kind of time? They said, oh, yeah, we have a list. Mr. President, I'm not making this up. This was something that sent cold shivers down my spine. We have a list. We call that list every month. And if they're dead, we cross them off. Is that what we want, Mr. President? Vote yes on this. Take a true look at what it is, and I encourage your support.
Further remarks on the amendment, Senator Kaiser.
Thank you, Mr. President. There are a couple of metrics in the world of health care that are really important and something you sort of bank on when you're making decisions. One is life expectancy. The other is infant mortality. Those are two solid, clear, vital statistics. Well, I got to tell you, the U.S. is not doing real well. Our life expectancy, as you know, is declining, in part because of our opioid epidemic. But our infant mortality rate is at 5.8 per 1,000 live births. In Canada, it's 4.8 per 1,000 live births. Those are statistics to take home.
Further remarks on the amendment, Senator Warnick.
Thank you, Mr. President. I don't usually speak on issues regarding health care because I don't sit on the committee, but I rise in support of this amendment. I also sat next to a person on an airplane one time, 24 years old, said he was from Canada, and he said, you don't want our system. So a 24-year-old person already knows that the Canadian system isn't what he would like to see for health care. My own doctor is Canadian. My primary care physician is Canadian. He practices here in the United States. He's been here for a number of years. He goes back to Canada to visit family, but he has raised his family here and is Canadian and practices here. So I would like to see this amendment be even further expanded. How many Canadians practice medicine here in the United States? Thank you very much.
The question for the Senate is adoption of the amendment proposed by Senator Oban. As many as in favor, please say aye. Aye. As many as opposed, please say no. No. Amendment is not adopted. Further amendment, Secretary Reed.
Amendment 408 by Senator Fortunato on
Last
page 3, line 28. Internal references accordingly.
I do want to remind members, if you injure yourselves yelling, we only have American health care available to you here, so. Senator Fortunato to move adoption.
Mr. President, I move the adoption of Amendment 408.
Senator Fortunato has moved the amendment be adopted. Remarks, Senator Fortunato.
This is a similar amendment. We had recently, what's that fat guy's name that did the, that actor that he did the 9/11 thing? Right? Michael Moore. So Michael Moore sang the praises of Cuba's healthcare system. So I think, just like we ought to look at Canada, we should look at the merits of Cuba's healthcare system and bring that information to come back so that we can analyze what great things that they are doing and what is their infant mortality rate and what is their life expectancy in Canada. You know, one of the things that we look at when we look at a healthcare system is before we had the Affordable Care Act, Whole Foods guy, the CEO of Whole Foods was on TV and he was talking about healthcare and he said, we, Whole Foods, offer our employees a $2,500 catastrophic healthcare plan. It cost us $350 a month or something like that. And then we give them a $2,500 medical savings account. That employee that worked for that company had 100% coverage. Now, if that employee did not use all that medical savings account, it rolled over to the next year, and eventually they could roll it into their retirement plan. I think the part of the problem that we look at when we look at health insurance, we look at going to the doctor and having the doctor paid for by somebody else. So when you go to the doctor, how many people go to the doctor and ask them how much? I went through the doctor and I said, how much? And the guy didn't know. Eventually, by simply asking how much, I had a little minor surgery done, but the price ranged from $22,000 down to $3,200 simply by asking how much. And Mr. President, I put it all on my Cabela card and got Cabela points. So it's a win-win. But when we look at this, let's also compare this to car insurance. You don't buy car insurance to change the oil in your car. You don't buy car insurance to change the tires. You buy car insurance for a catastrophic event. I asked an insurance company one time, how many claims do you have that are less than $300? And it was something like 80%. So 80% of the claims that are processed by this gigantic insurance company, all those people working on processing your claim of $54 for your prescription drug and your
Senator, please begin your concluding remarks.
doctor visit, all those claims are adding to the overhead of the insurance company. If people simply asked how much and took that money out of their pocket and paid for it, their premium would be less, their deductible would be less, and they would be able to take advantage of a wider spectrum of medical insurance plans available.
Senator, you're done. Thank you so much. Further remarks, Senator Cleveland?
Thank you, Mr. President. Well, getting back to the amendment before us, as we know, Cuba operates a national health system, which is different from our U.S. system of health care. We could stay here all night, I'm sure, and debate a lot of various different countries' systems of health care, but I would like to bring us back to the issue at hand, which is universal coverage work group to begin to explore different methods of health care that would better serve the citizens of the state of Washington. I have heard from a number of colleagues throughout this legislative session that our health care system could be stronger, and that's where we're needing to put our focus and attention. Universal coverage is defined by three critical dimensions. Those dimensions are who is covered, what services are covered, how much of the cost is covered. These are the questions that we need to find the answers to. These are the questions that the work group should put their focus and attention to. And we must remember as well, as policymakers here in the state of Washington, we need to look through the lens of what's best for the citizens of this state. And I urge a no vote on this amendment.
The question before the Senate is adoption of the amendment proposed by Senator Fortunato. As many as in favor, please say aye. As many as opposed, please say no. Amendment is not adopted. Further amendment, Secretary will read.
Amendment 409 by Senator Erickson on page 3, line 28, after 3. Internal references accordingly.
Senator Erickson, do you move adoption?
Thank you, Mr. President. Move adoption of amendment number 409.
Senator Erickson moves the amendment be adopted. Remarks, Senator Erickson.
Well, thank you, Mr. President. This is actually a serious amendment that says that when we do the study, we should include Venezuela and their health care system in the study of what we're doing. And the reason for that is the tendency when it comes to this universal health care coverage, single-payer systems, there's always a tendency to go and look at the northern Scandinavian countries. We're going to go look at Norway and Denmark and Sweden and see how things are going up there in that population. And it's a very bad comparison to the United States of America to compare us to Norway or Sweden or Denmark because of just the incredibly different demographics, population growth charts when it comes to those countries up there, their income base, you know, where they get their money from. Norway, for example, is one of the largest oil reserves in the world, and they are a single-payer health care system, but it's a very different country. And so I think it's important that we compare to all different types of countries throughout the world. Venezuela being a great example of a country that was once strong. It used to have an economy that was stronger than Japan's, and now has fallen to being one of the most distressed and troubled countries in the entire world. You'll notice that the people of Honduras and Guatemala are not having caravans to go to Venezuela. The caravans are coming north into the United States. And that should be an indicator of what we want our healthcare system to look like. And so clearly we have a system that people want to come into currently, so why would we model a healthcare system on a country or a style of healthcare where people are fleeing from. That's why I think it's important to include this directly in the study so we know what to avoid, how to avoid having a system like they have in countries like Venezuela. I think that'd be a very important thing to do. I think we should also have included Cuba. I know that members of the legislature have traveled to Cuba to look at their healthcare system and held hearings on it here in Washington state to look at their system. And there might be things that we can gain from the Cuban system in terms of how we can have healthcare centers that treat people in certain situations. All of these things should be looked at. I think what we'll find when we go through the study of Cuba and we go through the study of Venezuela, and even when we compare ourselves to European countries, you will find that our system here in America works the best if you have insurance and access to health care. And when we look at the three things, as the good gentle lady from Southwest Washington pointed out, when it comes to health care, she forgot to mention access. And the key thing, we can talk about Medicare and Medicaid all we want, but if your doctor will not take Medicare or Medicaid as your insurance, you do not have access to health care. And so if you are a senior citizen who does not have a doctor and you are on Medicare and you go to try to find a doctor in many places of Washington state, you cannot get a doctor because they do not pay enough money through Medicare, so he will make money or he or she will make money providing that service to you. So it's important that we look at all the systems that are out there to find out what's wrong with America. And I think we will find America is not that bad. America is not that broke. Our healthcare system is actually functioning really well, and we shouldn't try to break it to look like these countries which are failing.
Further remarks on the amendment, Senator Cleveland.
Thank you, Mr. President. Well, this amendment again highlights the fact that different countries have very different approaches to their healthcare systems, and rightly so. I think also this debate highlights something that I said earlier on this Senate floor today, that there's a philosophical difference of opinion here. And that difference of opinion is around whether healthcare is a right or whether healthcare is a privilege in this country for only the very rich. And we're legislators that are charged with exploring and determining the strongest policies possible for this state. So pertaining to this amendment, let's leave Venezuelan policies and healthcare to Venezuela, and let's oppose this amendment today. Thank you.
Further remarks, Senator Erickson, the maker of the amendment.
Thank you, Mr. President. You guys, the maker of the amendment, just to conclude really quickly on my comments, which is to say, it's important to compare to other countries. If you go to college, you take comparative governance. You want to compare to other places and know why America is better. But I will tell you, if you are a middle-class American, you have access to the best health care in the entire world. And that is the key thing. And that is why we've had such a hard time, people have had such a hard time socializing medicine in America, is because middle-class Americans and middle-class Washingtonians have the best access to the best health care in the entire world. And we should expand that to more people, not take it away from the middle-class families that will be punished by going to a single-payer system, a la Cuba, a la Venezuela, or even, to be honest with you, a la Denmark or Canada. So it's important that we take a look at the rest of the world so we understand what we currently have here, which is good, particularly for middle-class Americans. We just have to quit fixing it. Every time the government tries to fix it, it gets more expensive. Stop fixing it. Keep prices low. Keep your doctor. Give me choices. And you'll have better health care than trying to go to a single payer and being like Canada. Though I like my friends to the north, I love Canadians, but their health care system, they can keep it.
The question for the Senate is adoption of the amendment proposed by Senator Erickson. As many as in favor, please say aye. As many as opposed, please say no. No. Amendment is not adopted. Senator Randall to advance the bill.
Thank you, Mr. President. I move that the rules be suspended, that second substitute Senate Bill 5822 be advanced to the third reading, the second reading consider the third, and the bill be placed on final passage.
Senator Randall's moved the rules be suspended, the second substitute Senate Bill 5822 be advanced to third reading, second reading consider the third, and the bill be placed on final passage. Hearing no objections, so ordered. Second substitute Senate Bill 5822 on third reading and final passage. Remarks, Senator Randall.
Thank you, Mr. President. I came to the legislature because of my family's healthcare story. Senator Erickson posed the question today about whether or not we had a problem before 1994. In 1993, my sister Olivia was born with microcephaly, which is what Zika has been causing in babies, and we didn't know how long she would live. At that time, my dad worked for the Department of Defense. He had a good job, had good insurance, but we didn't know how we would be able to pay for Olivia's health care if she did survive. It was because this legislature made the bold decision to invest in Medicaid expansion in 1993 that my sister was able to live for 19 years, a full life at home with my family. We didn't have to worry about whether we would be able to afford the wheelchair she would need, the feeding tube and supplies, the inflatable vest that kept her from getting pneumonia more than 5 times a year. We were able to concentrate on taking care of my sister and ensuring that she had a good life with us because of Washington's decision to expand healthcare coverage to families like mine who needed it so desperately. I went on to work in the healthcare field, Children's Hospital Boston, San Francisco AIDS Foundation, and at Planned Parenthood to make sure that women and kids, old people and young people, immunocompromised folks, that folks across the country had access to the healthcare that they needed to live and work and learn and be a part of our great country. I'm so proud to represent my community here in Washington because Washington has been a part of leading our healthcare expansion for so long, and I'm so excited to continue that work now. We have heard throughout the day great ideas to ensure that folks in Washington state have access to affordable, high quality, comprehensive healthcare that not only that will help them lift themselves up and take care of themselves and their families, but healthcare access that should be a right. We live in the greatest state, in the greatest country, and no one in Washington should be afraid of losing their home or not being able to afford food because they get sick, because they have a
Senator Wilson, I'm sorry, Senator Reynolds, please conclude your remarks.
We have a great responsibility today, and I hope you will join me in taking this step to vote yes on this bill and take care of everyone in Washington.
Senator Wilson, did you want to excuse, were you looking to excuse someone?
No, I would like to speak on
Okay,
this.
then please, one moment. Then let me go to Senator Oban.
Thank you, Mr. President. The vast majority of Washingtonians have insurance. They have insurance through their employer, over 80%, or through Medicare or Medicaid or the VA. Something around the nature of, or the number of about 95% are insured. And thanks to the expansion of Medicaid, which many of us voted for. So we are taking up a work group that will basically study different approaches, which include a single-payer system, because of roughly 5% who aren't insured. That makes little sense to me, particularly when we know the vast majority of those who are insured through their employer are very satisfied with that plan. Why would we, other than for perhaps ideological or other reasons, why would we even make the effort of studying an approach that would turn that system upside down? Some will say, well, it's just a study. But if this was a bill before us to study whether we should create a 51st state, we'd all say that, or many would say, maybe not all, but many would say, that's not worth the legislature's serious efforts. That's not certainly worth a work group. So clearly, the majority is interested in studying and possibly pursuing a single-payer system that would dramatically transform to the negative the way we finance health care. We've seen it in other systems, much to their detriment. We've talked about Canada. Those who are sick and have to wait come to this country, a more market-based system. The last thing we should do is to those middle class, those working class, and many others which rely on the existing system and are very satisfied with it, to send the message to them, that we are considering as a legislative body, their representatives, that we are considering setting apart and turning that system on its head. That makes little sense to me, and I don't think this body should be sending that message to individuals who rely on their health care plans, who want to know that they can pick their doctor and not have the government potentially pick it for them. I urge the body to put this bill down.
Senator Wilson from the 30th.
Thank you very much, Mr. President. For the last 25 years, I've worked with thousands and thousands of families with children, many on the lower end of the income scale, but many also middle income with children with special needs. We've talked about the fact that access to affordable health care is a right, but I also know there are many people in our state that don't have access and don't have coverage. And I heard from a child care provider from Tacoma. Her name's Peggy, and she has 2 child care centers in the Hilltop neighborhood, and she serves, the majority of children she serves are from communities of color. And she's been working in child care for over a decade and employs currently 20 workers in her 2 centers, and she cares for infants, toddlers, and before and after school care. But because of the cost of high premiums as a business owner, she's unable to offer health insurance to her employees, and because of that, she has a high turnover rate, which impacts the quality of care that we're giving our young children. Her daughter also works for her and works in an infant care center, in the infant care room in one of the centers, and has type 1 diabetes. And that young woman's insurance runs $700 a month. And again, because her mother is unable to afford the premiums for her workers, and to pay for that, she can't pay her daughter, and her daughter pays $700 a month, can't afford to live on her own, and therefore now and continues to live with her mother. Many of the families I work with benefited from the basic health plan, and it is a great plan for kids and families in our community. Children need care, but so do adults in our system. And adults who have children often give up their own care and taking care of their needs because of the needs of their children and because of the cost of that care. Also, adults tend to use oftentimes emergency rooms as their care if they don't have coverage, and we know the cost of that is also expensive. A living wage job and access to health care are critical, and they're a right, and they are not a privilege. They are a right. Oh. It's not a privilege. Every one of us, regardless of age, regardless of status, regardless of where we come from, regardless of what we believe, have a right to have access to make sure that we're happy and that we're healthy. And we need to do this for the constituents and for the folks who live in the state of Washington. Thank you.
Thank you. Further remarks? Senator Erickson.
Thank you, Mr. President. I would have loved to have seen a study come out of this body tonight that would have been more bipartisan in fashion, to say we were looking for ways to make health care more affordable and accessible to all Washingtonians. The underlying study we have in front of us, I think, is geared towards defining the problem in a different way. The problem being we don't have a single-payer socialized system, and how do we get there is how the current study is shaped. And so I think we do need to look at this as a state and as a country at ways to make health care more affordable. And there are lots of things you have to look at when it comes to that. Mandates on health care insurance. Important one to take a look at. You have to look at our legal system in America. What tests are required because of the legal system that normally wouldn't have to go through to save dollars? When I had my appendix out, I went into the doctor. The doctor came in, pushed on my abdomen, and said, "You have an appendicitis. We're going to take it out." But they forced me to go through an MRI first. Cha-ching, cha-ching. $3,000 later, I'm out of the MRI, and they're taking out the appendix. There was no need to go through that, but they have to do it for legal reasons, for their liability. There are so many things that we could have put into the study to look at how do we make health care more affordable. And we also could have added language to this which would have said, how do we protect the people of America who already have, in Washington State, have access to phenomenal health care? And it's not just the wealthy, it's the middle class. And I don't try to use personal stories too much on the Senate floor, but my wife had open heart surgery where they went in and replaced her valves. And so here I am, we're middle class Americans. You couldn't be any more middle class than the Erickson family, and I think we were in Bellingham at that time. You know, I'm a part-time legislator and she's a school teacher, right? If we didn't live in America, she would not have gotten that heart surgery. And so that's the part we want to preserve going forward, is how we protect that for those people who currently have the access while we expand it to everybody else. We got a system that is phenomenal. We can do better, but we have to be looking at ways to expand the great system we have and not to destroy it. You know, there's that saying, you know, we had to destroy the village to save it. We don't have to destroy our healthcare system to save it. And I'm afraid if we go down this pathway of single payer, all of these Washingtonians and all of these Americans who currently have access to excellent health care will not have the same access they currently have today. And that's been the great problem those who want single payer have always faced in America and in Washington, is that the vast majority of people here have access to great health care. So why are they going to give it up to go to a different system? And that is the problem. So unfortunately, what's happened with things like Obamacare, the 1994 Health Care Reform Act in Washington State, it's been a mechanism to get more and more people off of their good health care to make them want to go to a single payer by driving up costs, reducing access, making it harder for employers to provide health care. And that has been the pathway we've been going down since 1994. It's the wrong pathway. It's been taking us away from more affordable care with, I think, not to assign intent, but I think with the purpose being to get more and more people off of their good health care, so they'll throw up their hands and say, just let the government take care of it. That's going to be harmful long term to the vast majority of people who have good health care. Like my family has enjoyed, other people who come to America looking to get that middle class lifestyle would like to enjoy. That's what we need to protect in America. That's what we can protect in Washington State. And I'm very disappointed that this underlying bill in the study didn't include ways to protect those people who are currently in the middle class, who have access to that health care, while we expand it and make it more affordable to all Washingtonians.
Further remarks, Senator Fracht.
Thank you, Mr. President. Well, there's a lot to say and not enough time in 3 minutes. I agreed with exactly one thing that my friend just said, and that is there are a lot of reasons, a lot of cost drivers in healthcare, but one thing he didn't mention is administrative complexity of our current system. That is something that all of us know about, whether you've been fighting with your health insurance carrier or trying to figure out what the 3 levels of cost are on the procedure that you just got that costs $3,000, but they're only covering $1,000, and then you have a cost share of this or that. Anybody who actually knows and uses the healthcare systems knows that there has to be a better way. All of those things will be caught up in, considered in this study. This is not turning the system on its head yet. This is looking at ways to move forward and also considering things that might happen at the federal level. If there is a state-based universal coverage waiver that might be coming if there is a new administration in Washington. Maybe there will be, maybe there won't be. But the one thing I want to point out, for all the talk about Venezuela and whatever else we were talking about, we didn't talk about Mauritania or Turks and Caicos. I have no idea what their healthcare systems are like. But, you know, Senator Cleveland and I had a forum in Seattle about a year and a half ago, and we met with folks to talk about healthcare systems and small business and what they're hearing. And there was this guy who came in, and this was at the Seattle Innovation Center. This guy was not a socialist by any stretch. He had started like 10 businesses, and he told us how he had started 10 businesses, and he was, pretty, full of himself, but he started 10 great businesses. And this guy was a hyper-capitalist. And what he told us was, and something that I hear all upon, he can't get people. Because you're right. If you are employed, you might have great health care. You might have great health care. We're lucky. We're employed by the state of Washington. We have really good health care. What happens if we leave? What happens if we lose? I don't like to think about that. But what if we did? We're out on the street. All of these people, they are job locked. That is a huge part of the problem of our system. There is no portability. Why aren't we thinking about that? People who go from employer to employer. People who want to start that great entrepreneurial business, the next great entrepreneur is Senator Erickson. They're stuck because they can't leave because they got 4 people that they're counting on their health care if they're at Microsoft or Amazon or whatever, and they don't know how they're going to pay for it. All of these things compel us to look for ways to continually improve our system and think outside the box. And that's all this bill is designed to do. So I commend Senator Randall for her great work putting this together, having us consider it, and I hope that this body will say yes on this bill. Thank you.
Further remarks? Senator Fortunato.
Thank you, Mr. President. You know, I agree with what Senator Frock has said, is that portability in insurance is important. And a way to achieve that is simply to make your medical insurance tax deductible. Right now, one of the advantages of having your insurance paid by your employer is it's pre-tax dollars. So if you want to take your insurance with you, if you're able to pay for that with pre-tax dollars, that sort of removes that problem, if you will. So that's like a 20% discount, 25% discount, depending on what your tax rate is. I want to remind people that when they talk about Medicare for all, look on your payroll stub when we go back tonight, and it says you took out, there's Medicare. You're paying Medicare out of your payroll tax. So when we talk about Medicare for all, here we're going to offer Medicare for everybody that, so we have 100% coverage. And then that guy goes home and he goes, holy crow, look at how much money they're taking out of my payroll to pay for my free insurance, which is like, I want you to think about having insurance run by the DMV. So when you go and you look at that, we're looking at controlling costs. And again, I have to go back to the fact that you buy car insurance because of a catastrophic event. You don't buy car insurance to change your oil or get your tires changed. Part of the problem with administrative costs being so high is that people are going to the doctor and getting a prescription drug for $54, and their insurance company is processing a claim for $54 or $125. How much could we reduce the administrative overhead of processing those claims if we simply opened up our wallet and paid for it? And we can pay for it with a medical savings account, even better. Pay for it and have it be tax deductible if we don't have a medical savings account. A guy said to me one time, I got cancer. I had a premium health insurance plan, and it cost me $18,000. Why is that? Senator Frock pointed to it. Look on your bill, 60, 40, 80, 20. Somebody's paying so much percent of the hospital visit. When it goes over there, should pay 20%. When it's through, we pay 60% of that, and 80% of this, and all this other nonsense. If you just simply looked at that and you said, you know what? Once I hit a certain level of deductible, whether it be $2,500 or $5,000, it pays 100%. We don't have any of that. And people come to me and they say, where would I get the money to pay a $5,000 deductible?
Please begin concluding your remarks, Senator.
Okay, so my insurance premium would be $350 for a $2,500 deductible or a $5,000 deductible, and $1,400 for a premium plan. I could pay for that deductible with the savings that I'm doing in insurance. So we have to remember that the Medicare that everybody is getting is being paid for on the backs of private enterprise when you go to the hospital.
Senator, thank you. You're out of time. Further remarks, Senator Cleveland.
Thank you, Mr. President. Well, it is true that through our state's many years of work to expand our Medicaid and to stand up a successful health benefit exchange healthcare insurance marketplace, we have made real progress in expanding the number of citizens in our state with healthcare coverage. But, Mr. President, due to a change in course at the federal level over the past couple of years, fear, uncertainty, and instability exists for many regarding their health care and health care coverage. And more alarming, Mr. President, the coverage gains that we've made here in this state are beginning to erode. Because the Trump administration has done everything in its power to undermine the health care coverage advances we've made here in this state, this bill is necessary. You know, last year in the Senate Health and Long-Term Care Committee, we heard testimony from the executive director of the United Nations World Health Organization, Dr. Nada Manapi, and she shared through her testimony the UN's goal of achieving universal health care worldwide by the year 2030. And we must, Mr. President, as a state, do our part to help achieve that goal because it's the right thing to do. Many, many questions requiring detailed analysis must be addressed before we can determine next steps for our state. This bill simply begins that hard work of providing the necessary information we need to plot our course forward to achieve universal health care. And for that reason, I urge your support tonight.
Further remarks, Senator Conway.
Thank you, Mr. President. Also standing in strong support of this. Actually, when I first came to the legislature, we had a similar look at this in 93 and 94. So I'm actually hoping that the committee will kind of look back on some of that experience as they look at this issue. But, you know, I think Senator Fortunato's hit upon something that I think is important, because I've heard a lot of people condemning the single-payer system, but Medicare is a single-payer system. People pay it for taxes from day one, and it's universal. So those who condemn single payers here are in essence also condemning Medicare. And I don't see a lot of people here condemning Medicare. Does it need to be improved? Absolutely. So why should we go away from this country to study a single payer system if we can study it right here at home with our Medicare plan? Because Medicare was invented here as a single payer system to deal with elderly people who had left employment. And yes, it doesn't completely work perfectly, but I know I've represented a lot of older workers in my day, and they're all looking at when they can become eligible for Medicare. That is their goal. And we've expanded Medicare to cover the unemployable too, the disabled as well. So this country is not, you know, is not looking at something completely odd here. We've been experimenting with a single-payer system with Medicare for years. And maybe what we need to do, one of the ideas I've always had is lowering that age of Medicare eligibility. And maybe that's the direction we need to go. I know that certain people are proposing that in Congress. I think that, you know, it makes sense in some ways. And I actually think that this study that we're going to do is going to reaffirm our state's leadership in working on healthcare issues. We were the state when Jim McDermott probably stood on this very floor as the state senator when he invented the basic health plan. And we just got through doing a complete study of the individual market in an effort to. And so we can be a leader on health care in this state, and we have had a long history of being that leader. And I think all of us on this floor should kind of look back at that history and recognize that we need to help the people solve what is one of the most important issues of our times, affordable health care and access to health care. And so I actually hope that we move forward with this study and see what it has to say and see where we might go. And let's not use our predilections for different social systems here in making this judgment call here today. Let's make a judgment call for being a state that is in the leadership of healthcare reform in the United States. So thank you.
Thank you. Further remarks? Senator Saldana.
Thank you, Mr. President. And I just want to share a story of one of my constituents who has been an inspiration and really a teacher for me about why we need to study healthcare and why we need a solution. As we spoke, many of us do enjoy the opportunity of having our healthcare through our employer. And that was the case for Gina Owens' daughter, Tiffany. In 2007, she had possibly had health insurance, although it was a fast food restaurant job that she had. And while she was employed there, she came up with pulmonary hypertension in 2007. She lost her job. And then there was no health care for her or her children. And she got so sick that she ended up losing her life. And so Gina Owens, then as the grandmother, was charged with taking care of her children. But it was because she had employer-based health care, and because there was by the time that she got lost and so sick to qualify and get the paperwork in order for Medicaid, she wasn't able to do that. And in the meantime, they lost their mother, their daughter. And Gina Owens became the parent of her children, of her grandchildren. And it was that experience that motivated a lot of us to call for a healthcare reform in the other Washington. And Gina's advocacy is one that inspired so many other families to tell their stories, that she and her grandchild were able to be there for the signing of the Affordable Care Act. And yet we now are facing a serious situation where there's still many families that don't have health care in Washington state, that can't afford it, that are falling through the cracks. And this is a study that will help us find our way forward so that we are putting Washingtonians first, above the interests of the insurance companies or the CEOs of those insurance companies, and making sure that we have a healthcare system that works, that is portable, that meets people's families and their needs where they're at.
Further remarks, Senator Cooter.
Thank you, Mr. President. I rise in support of this bill because I am a passionate supporter for universal health care. I didn't come to this early, or late, I should say. I've been a supporter for over 25 years, and it originates out of the birth of my daughter in 1993. Emily was stillborn at 6 months gestation. She was revived. She weighed 1 pound, 13 ounces. She spent 5 months in the hospital, Mr. President. She had 3 surgeries over that time period. She was medically fragile when she was discharged after 5 months. And when I got home, there was a letter from the insurance company waiting for me, telling me that my daughter, my 5-month-old tiny infant, had nearly reached her lifetime cap. So when I hear that government always messes things up, I say, no, that's not true. Because when Obamacare came in, guess what Obamacare got rid of, Mr. President? Lifetime caps. It also got rid of pre-existing conditions, which my daughter has a cornucopia of. So, Mr. President, what we're talking about here is health care is not a privilege. It is a human right. And it is incumbent upon us to make sure that Washingtonians have that right. And I am tired of hearing that the government mucks everything up, because it doesn't. It is working toward a system of health care that will work for all of us, that is putting people first, that is making access to affordable health care possible for us. And Mr. President, in our country, we have thousands of people who die from curable diseases every year under our system. We have a Frankenstein model of health care. We carve out a program for Medicare for seniors. We have a program for Medicaid for poor. We have a program for veterans, the VA, which my good friend from the 42nd would be interested in knowing is true socialized medicine. Would love to know his opinion on whether he'd like to get rid of that. We also have a separate program for Native Americans. We have private health care through employment. And then we have millions who are uninsured. With all that, we still have millions of people who are uninsured. That's an abomination. That's a Frankenstein model. We can do better. And Washington has been a leader on so many areas, and it's been a leader in health care. We're going to lead forward by having a study done that will really get to what works best. What's the smartest path forward? And I really commend this bill to the body and hope it gets a bipartisan vote. Yes, thank you.
Thank you. Further remarks? Senator Hasegawa.
Thank you, Mr. President. Speaking in strong favor of this bill, part of my history, I've negotiated a lot of labor contracts, but going all the way back to the 1980s, healthcare costs and inflation were eating up all of the workers' wages increases. Every dime that we would try to negotiate was going towards covering the cost of healthcare. And the one thing I found out is that most of these employers want to be good employers. They want to provide good health care coverage for their employees, but it was just getting cost prohibitive. And then in 1993, there was a threat of universal health care coverage. And amazingly, that put a cap on the cost increases. I mean, not a literal cap, but figurative cap. The healthcare costs actually flattened while there was the threat of universal healthcare hanging out there. After 1994, then, again, it started climbing again. So in 2004, when I ran, I campaigned on this issue strongly, and in 2005, I had a bill to do just this, to create a task force to look at creating universal healthcare system here. The legislature actually, I don't actually remember if that bill passed, but they did create that task force. They called it the Blue Ribbon Task Force on Universal Healthcare Coverage or something like that. It was a four-corner task force, and actually nothing ever came of it. And so that was my disappointment with task forces, because I am hoping that this doesn't end up in that same ditch along the side of the road as that effort that I tried to push forward 15 years ago. We have to do something about health care. It is just eating up the soul of our country here in people's wages, the lack of portability, people feeling stuck, people living tenuously, not knowing if they get laid off tomorrow, what their family's going to do if they have a pre-existing condition or whatever. So I am really looking forward to following this task force and making sure that it follows through on the work that it's mandated to do, and then we then follow up on the work of the task force as it recommends us to do. So with that, I'm asking for a yes vote on this. Thank you.
Senator Elias.
Thank you, Mr. President. I call for the previous question.
Senator Elias has called for the previous questions if sustained by two additional members. Now the question before the Senate is Senator Elias's motion to put the previous question. As many as in favor, please say aye. Aye. As many as opposed, please say no. Motion carries. Before we do that, because I know you all are going to run out of here as soon as you cast your votes, this is important. I want everyone to hear this for a moment. We're about to go back into the other mode. We're not going to be spending as much time with one another, and so this is a good opportunity for us to recognize the people who make this all possible for us here on the floor. Of course, we know how hard the legislative support folks are working, LegTech, LSS, and everyone, our caucus staffs, our Senate committee services, everyone, but I want to put special emphasis on the floor team here that works into the night, works on weekends, and that works so diligently so that when you all scrawl out an amendment at the last minute, you will notice that it is elegantly uploaded and available very quickly. And so I particularly want to thank Senate Security, who have worked so hard and who keep us safe and do it with professionalism. I want to thank our Secretary of the Senate and his team who read these bills, who distribute these bills, who make sure that everything is done so functionally and so well for us all throughout the session. And of course, the two brilliant attorneys who actually make me look semi-competent when I'm here, and I know Senator Kaiser, Senator Conway would agree with that. We are so fortunate to have these folks. They make you all successful, so join me in thanking them for their work. Question before the Senate is final passage of Second Substitute Senate Bill 5822. The Secretary will call the roll.
Bailey. Becker. Billig. Braun. Brown. Carlisle. Carlisle. Cleveland. Conway. Darneal. Doss. Dingra. Erickson. Fortunato. Frocht. Hasagawa. Hawkins. Hobbs. Holy. Honeyford, Hunt, Kaiser, King, Kuderer, Leas, Lovelet, McCoy, Mullet, Wen, Oban, Patton, Palumbo, Peterson, Randall, Rivers, Rolfus, Saldana, Solomon, Schessler, Sheldon, Short, Taco, Vandeweghe, Wagoner, Walsh, Warnick, Wellman, Wilson Clare, Wilson Linda, Zeiger.
Senator Carlisle, how do you vote?
Mr. President, there are 28 yea, 21 nay.
Having received a constitutional majority, second substitute Senate Bill 5822 is declared passed. The title of the bill will be the title of the act. Senator Leas.